50 million people worldwide are living with Alzheimer's disease and other dementias, and 150 million caregivers have put their lives on hold to provide high-stress, complex, and time-consuming care for those 50 million people. This disease over time robs people of their ability to remember, to think, to communicate, to feed themselves, and even to swallow. Eventually, it robs people of their lives. Alzheimer's disease was first diagnosed in 1906. More than a century later, we still don't have a cure. Patients and their families are waiting. Given the high emotional and economic toll on patients, families, caregivers, and our global economy, we can't afford to wait. That's where Us Against Alzheimer's comes in. We are innovators, conveners, and collaborators, and we are hell-bent on bringing the right people to the table to address this immense challenge in the right ways. Every day, we bring stakeholders together from across sectors like science, business, and government, along with patients, caregivers, and communities, to knock down barriers that are slowing treatments and cures. Not enough understanding of the disease, too few drugs in development, and not enough new approaches to stopping the disease. Slow, inefficient, and unrepresentative clinical trials. Inadequate government policies and regulations. Inaccessible and underutilized data. And pervasive fear and stigma. We know creating health system change to address Alzheimer's is going to take all of us. That's why we insist on an environment of collaboration, innovation, and acceleration. We're knocking down those barriers to accelerate a cure because patients and families have waited long enough. The first step is better understanding the disease. We've worked to secure unprecedented increases in NIH funding to support basic research into Alzheimer's. Knowing how the disease works can lead to fast and informed decisions that will speed up our progress. Already, with new funding, researchers are making progress on diversifying the types of treatments we are testing and finding new ways to identify the disease at its earliest stages. We now know that Alzheimer's starts to form in the brain 20 years before symptoms develop. Getting drugs into development is how we learn what works, what doesn't, and what holds promise. We're spurring investments to turn basic science into meaningful treatments to benefit people at risk. Clinical trials are how we determine what is safe and effective for people, but they can be too slow and inefficient. And this is made worse by a critical shortage of trial participants and limited capacity to take on those that are willing. That's why we launched the Global Alzheimer's Platform to accelerate and build our national capacity to test new drugs and promote participation. And we're working to diversify clinical trials through community mobilization, education, and by promoting transparency. Sometimes well-intentioned government regulations slow the path to accelerate detection and diagnosis and the pathway to clinical trial participation. They can lead healthcare providers to shy away from talking to patients about Alzheimer's, and they can slow important access to care. We're working with regulators to knock down those barriers by making changes to the rules that can have a big impact on people with Alzheimer's and caregivers. We have spearheaded legislation and worked with the administration to change this. We created AD PACE, a first-of-its-kind patient and caregiver-led collaboration that delivers new insights to researchers, regulators, and payers. We're developing innovative programs and partnerships to leverage digital technologies and big data to predict Alzheimer's through the Global CEO Initiative on Alzheimer's Disease. And through the Alzheimer's Disease Disparities Engagement Network, we're using data to map disparities and target our community outreach to those most at risk. Treatments must be found that work for everyone with the disease. We are working to develop a culture of brain health by encouraging risk reduction, early detection and diagnosis, and discussions among people and their doctors. We know that women and people of color are more likely to get Alzheimer's, so we are leaders in advancing equity and access to Alzheimer's research and resources. We are preparing the healthcare system for the day when treatments and cures are approved. We're working with the government, drug companies, insurance companies, and medical facilities to ensure the health system and payers can and will deliver treatments and care to patients who need them when they need them. Of course, at the heart of each of these areas are the patients and their families waiting for a cure. The women who make up 2/3 of the patients with Alzheimer's disease and 2/3 of all caregivers. African Americans and Latinos who are up to 2 times more likely to be diagnosed with the disease. Veterans who are at higher risk because of combat-related issues such as PTSD and traumatic brain injuries. People in low- and middle-income countries who in a decade are expected to make up 63% of the people living with the disease globally. And of course, we also include the 16 million caregivers in the U.S. who sacrifice and endure along with the patients. Without patient and caregiver involvement in every step of research and care, no success will be complete. So it is with the patient in mind that Us Against Alzheimer's approaches our mission. We do our work every day with the knowledge that patients are waiting, caregivers are waiting, families are waiting, the world is waiting. We're done waiting. Join us at UsAgainstAlzheimers.org. Take action and help accelerate an Alzheimer's cure for all.